Hi, my name is Alexis Davis. I'm a vascular surgeon at Bryan Heart. When I was in middle school, my brother actually had a near-death experience, and so that was my first introduction to medicine. We were in the scariest time of our lives. We had no idea what was going on, and yet these physicians came in. They were able to talk to us, comfort us. He ended up surviving. However, over the next few years, during the time when you're trying to figure out what you want to do with your life, I just kept on getting drawn back to medicine. I went to University of Miami for undergrad. Then I went to Tulane after that for a one-year master program. After that, I went to UT Houston or McGovern Medical School. And then after that, UTMB Galveston for my vascular surgery training. Vascular surgery is basically a disease of the arteries and veins. So it ranges from things like blockages in the arteries in the legs and the arms. Peripheral arterial disease is what that's called. We also deal a lot with venous insufficiency. So when you have swelling in your legs, the valves just don't work as well, and so they're not able to move blood back to the heart. It also deals with the weakening of the artery walls and the veins. So for instance, things like aneurysms when an artery gets really big. The biggest thing that I liked about medicine is being able to personally connect with people. And so I really feel like that's kind of my style when I meet people. I like to connect personally with them first, learn what the problem is, and let them know if I can help them in any way. So I really kind of view it as a partnership. I'll do what I can, and I want you to do what you can, so we can reach to a result that we both find is satisfactory. That's also another interesting thing about vascular surgery. It does kind of span through the lifetime. So I would say majority of our patients are the elderly population, but then also there's still a small subset of patients that are young in age, as well as people who are maybe middle-aged. So I like the personalized care that Vascular provided, as well as the long-term care. I really want any patient that comes to see me to be struck by the kindness of the people, by the caring nature of everybody that's involved. But as well as that, I want them to be educated about their disease. I want them to leave having learned something and having tools to help themselves to get better. As soon as we came here to Lincoln, we were just struck by the kindness of the people that we came in contact with, not only in the hospital, but also outside the hospital. I was very impressed by all the different technology and capabilities. That was exactly what I wanted, and this was the only place that I found it. I think back to, the time when I was, I was the kid in the hospital room with my brother, and, we were scared. We didn't know what was going on. It was the worst day of my life. And so they were able to come in and comfort us. It's the reason that I get up and go to work every day, just knowing that I can have that personal impact on anybody. It's such a privilege to be able to do that.